got gluten, dairy, and eggs are also a problem for you.
Okay, then I've been eating eggs for my whole life a lot. So I'm gonna stop doing that.
Yeah.
Most of the time when people test positive for eggs, it can be a false positive. We're actually going to be looking at a red table talk that Jada Pinkett-Smith and her family did with Dr. Mark Hyman. And it's about functional test results for their family. And I'm really fascinated to actually do a live reaction video to the session that they had with Dr. Hyman. And it's really an interesting story, which is even if you're rich and famous and you have money, does that mean, even with the top functional doc or one of the most visible functional docs, does that mean that you have the health results and outcomes that you want to get?
Fatigue, sensitive
Yeah.
stomach, feeling weak, tired every day,
Exactly.
anxiety. That leads to the leaky gut. And so you've got gluten, dairy, and eggs are also a problem for you.
Okay, then I've been eating eggs for my whole life a lot. So I'm gonna stop doing that.
Yeah. And the best thing to start the day with is fat and protein.
Yeah.
Avocados,
So,
nuts
yeah.
and seeds, all that stuff will help you to keep your sugar even, not have
Exactly.
swings, not have cravings. Because that craving stuff is not because of lack of willpower.
Yeah.
Well, if your gut's a mess, you're not going to have the right appetite. If your
Yeah.
hormones are out of whack, you're going to be
True.
craving the wrong things.
Yeah,
Oh,
exactly.
he said
And just to
hormones.
finish up with you, you also have a lot of nutritional deficiencies,
Yeah.
right? Well, the B vitamin things affect anxiety.
Yeah.
Vitamin D causes fatigue, depression.
Yeah.
They call it
true.
SAD or SAD,
Yeah,
right?
definitely.
So a couple things here is that they mentioned eggs as well. So I'm just going to let you guys know is that one of the issues when a doctor tells somebody, it sounds like they might have had some food sensitivity testing done. I'm concerned here because just FYI, based on our food mapping process, all the different types of tests that I've done, most of the time when people test positive for eggs, it can be a false positive. And I hear this all the time, people coming in saying, I've been avoiding eggs this whole time because this other test said I had to avoid eggs. But the problem is with people with the autoimmune population is they frequently test false positive to eggs. And in our food mapping process, I show you how to tell the difference between the two. So then truly the people that are intolerant to eggs is actually a very small amount. I would say 1 out of 20. But yet, if you go and look at these test results with people with autoimmune disease, probably 20% of the time it will test positive for eggs and it's a false positive. So this to me also highlights the invalidity of a lot of these tests. And a lot of times, if someone is not an expert in autoimmune disease and they're taking this food test and they're applying it to the autoimmune population, they can give wrong advice, further limiting your diet. And as Willow was saying, not being able to eat eggs could be a big problem for her because fat and protein is really great to start your day with. And for some people, unnecessarily eliminating that could be a big problem. So, what I feel like is missing from them is accurate food mapping. I'm willing to put money on this that if we were to put them through food mapping, there's probably an 80% likelihood that it may not be a true egg positive. But at the same time, no one else on the planet really is teaching this because, I mean, having worked with, thousands of people with autoimmune disease and seeing these test results, I know that the autoimmune population can test false positive for eggs a lot. And I do have a way to tell what's real and what's not, whereas a lot of physicians who don't specialize in autoimmunity may not understand that. But I'm really glad they're bringing this topic up, though, and that she's at least addressing maybe some of these foods is triggering some of these symptoms. But I'm going to tell you is most people guess using elimination diets. Other people will use food sensitivity testing that are inaccurate, and even good physicians using good tests can actually give wrong results sometimes because they don't realize that people with autoimmune disease can have false positive or negatives. If you like this video, give it a thumbs up. If you're watching this on YouTube, give me a subscribe to the channel and give me a thumbs up. Comment in the comment section below. Tell me what's one thing that you learned here that was mind-blowing for you.